So good morning to all. Welcome to this keynote session. It's a great pleasure and honor to introduce our keynote speaker, Professor Rema Hanna. Professor Hanna is the Jeffrey Chi Professor of Southeast Studies and Chair of the International Development Area at the Harvard Kennedy School. She serves as the co-scientific director of J-PAL Southeast Asia and co-scientific director of the Social Protection Initiative, a joint effort of the J-PAL and the Center of International Development at Harvard. She's also a research associate at the NBER and affiliate of the Bureau for Research and Economic Analysis of Development. And her research focuses on improving public service delivery in developing and emerging economies with particular attention to poorest populations. Combining theory, fieldwork, original data, and rigorous empirical methods, her work provides fundamental insights into corruption, bureaucratic incentives, discrimination, social protection, tax administration, and environmental regulation. Part of her work focuses on how to improve overall service delivery, especially for minority groups. Professor Hanna's research has been published in top journals in economics, such as AER, QJE, JPE, among many others, and she is part of the editorial board of the American Economic Review. She holds a PhD. I'm almost finishing. It's a lot, I know. She holds a PhD in economics from MIT and a bachelor degree from Cornell University, and she was teaching at the New York University before joining Harvard. We are very, very honored to have her here today. I could spend much more time talking about her incredible resume, but I'll save minutes so we can listen to her, telling about how we can strengthen the state capacity through research engagement. So please join me welcoming Professor Rema Hanna.
Hi, thank you so much. Can you guys hear me? Yeah, for the kind introduction. It is such an honor to be here, and thank you all for coming. I'm going to be talking about strengthening state capacity through research engagement. This is something I've been thinking about for a while, given some of the examples of the work I'm going to be showing today. And it's also based on a piece I've been writing for I work a lot. A lot of my research is based in Indonesia, and a piece I've been writing for the anniversary issue of the Bulletin of Indonesian Economic Studies, to try to really think about how do we place the research into the context and think about how it could be useful in terms of helping to strengthen public policy. Oh wait, so is it this one? Okay. So why is it interesting to increase state capacity? So in this room, I'm probably not going to need to tell people why we care about governments, but they are a large provider of key public services, health and sanitation. I work a lot on transfer programs and education, on safety, industrial policy. We need governments to function. And in fact, actually, I always think that you don't realize how much government touches your life until something actually goes wrong. But every aspect of our lives are really touched by the fact that society comes together to provide common goods for everybody. But the challenge is it is really difficult to provide these public services, even in high-income countries, and then low-income countries, it's even more of a challenge. So for example, I do a lot of my work in Indonesia. One of the big challenges is budgetary. GDP, tax to GDP ratios are very low. I think 11% of the country pays taxes, so the budget issues are real, and it affects the kinds of services you could provide. It affects the kind of people you could hire into the government to provide these kind of services. Then there's other challenges as well. So there's informality in the labor market. So the government often doesn't have a lot of information about individuals. Even a lot of times the ID card systems of just who's in the country are not necessarily updated, and that's challenging to figure out how to find people to provide services, much less anything else. The banking systems have a lot of challenges. In the US, I work on transfer programs. A lot of the transfers are all done through banking systems. But in a lot of low-income countries where these systems are very underdeveloped, it provides another challenge. And then in general, you just have a lot of these implementation challenges when you have issues around roads, you have issues about infrastructure. So It's just worth remembering how hard the problem is, particularly for low and middle income countries, in terms of providing these kind of services and even deciding which types of services to really focus on and how and such. And so for me, that's why I think what we do in economics and the research that we do is so important, because it helps inform a lot of these decision-making processes. And so that's why I've been really excited. And as I said, I've been thinking back for this review piece about how there's just been such a rise in development economics research over the last 20 to 25 years. You really see this first with a huge rise in just available public data sets that really facilitated this kind of research, rise in quasi-experimental research. Today I'm going to be talking a lot about field research, which is what I work on. And I do think there's two types of studies. So one type of study is kind of smaller scale studies where you can work with nonprofits or you work in a lab in the field. And I think for me these are really exciting because they show on a smaller scale what can work or not work. And they also help us identify these theoretical mechanisms of why things are working. And they give upper bounds of, if you can get it to work in practice, this is what you might be like in a smaller scale study. This is what the upper bound might be if you try to scale up. So I think these studies are extremely, extremely important. But what I want to talk about today, is about working directly with government and building research into government. And it's oftentimes, especially in economics, you often hear people dismiss these kind of studies working with government as just a policy evaluation or such. But in reality, you can actually learn quite a bit in terms of the economics about how these programs, policies, and how economics actually functions in practice. And so I do think it's very important. And I think in this sense, the working with governments can really change how you ask research questions and the kind of questions you're able to study. And part of it is because oftentimes these are going to be bundled interventions. Just naturally, you're not going to be able to isolate a particular channel because naturally things come bundled together when you provide a program or policy. The second aspect of why it's really, and the bundling is actually really important because that's what works in practice. The second reason why they're often very important is because there's often a lot of implementation challenges when you're running these programs at scale, when you're working with government, and that's going to determine the success or failure and determine how people react within the program and the behaviors within the program. And so understanding how that actually works is extremely, extremely important. And I'll give some examples as I start to go through some of my own research. The third is the interaction with markets. When you do things at a small scale, you're not really necessarily seeing the general equilibrium effects, but we all know in economics that these things are actually quite important. And so, for example, I work on transfers. One of the big issues is how do transfers interact with prices for certain goods in the markets? And I'll talk about that in a bit. I work on programs that match people to the labor market or provide training for workers, and how does that affect not just does somebody get a job, but how does it affect other people in the labor market and the types of jobs they get and wages. And so we know these general equilibrium effects are important, and working with governments that are doing things at scale allows us to study these kind of issues, which are very important. And then it also goes back to this issue. We know there's a lot of heterogeneity in the world, and when you work with governments and you work at scale, you're able to see some of the heterogeneity and how things work under different conditions. In areas, I work in Indonesia. It has thousands, and I think it's something like 80,000 islands. And some are very highly developed with really good institutions. Some have weaker institutions, limited infrastructure. And how do these programs and policies work in different parts of the country, I think is important to see as you're trying to understand the economics behind a lot of these policies and programs. Okay, so there are some nice examples that I love. Like, for example, the original study by Paul Gertler on Progressa in Mexico, and all the subsequent CCT studies that have evolved from this have really, really changed the way we think about policy and changed policy in many countries around the world. Very nice paper in India where they're working with a state in India to look at biometric smart cards and the effects on transfer programs. Some recent research was a lot of work with graduation programs in the context of these smaller scale studies. There's recently a nice study done where they looked at it at scale in Zambia and measured impacts and compared to the smaller scale studies and such. So there's a lot of these nice studies. I'm gonna, given that you invited me, take the opportunity to talk about some examples from my own work of why I think working with the government was important, how it changed the way I thought about the research questions I could ask, what I was able to measure or not measure by working with government. And then I want to end with some questions of, this is, for those of us who are working directly with government partners, I like to think of myself as very technocratic and focused on the research, but you can't abstract away from the politics involved in the background and have faced challenges around civil rights and voice and restricted research environments and transparency. And so I thought that might be a good way to end and to have a broader discussion of these kind of challenges. Okay. So, a little hot up here. Okay, so as I talked about, I want to talk about 3 examples from my own research. I feel a little old now, like back reviewing my career. But 3 projects that I find very important in terms of my own way of thinking about public policy and working with government. The first is going to be a project we did at scale with the government for this national reform in Indonesia, comparing in-kind transfers of food distribution with cash transfers. The second is going to be it's a series of projects I worked on, both with nonprofits and government, about trying to improve employee attendance in the public sector. And then the third is my passion in life, community-based targeting. And I'm going to show you a series of projects we did and how that evolved over time and what it meant in terms of working with the government. Okay, so as I said, the first project's on food distribution versus cash. So, this is a fundamental sort of debate in many countries around the world. Should they give cash transfers or should they do in-kind transfers? And you see a combination of both around the world. You see a lot of energy subsidies. You see a lot of food subsidies. At the same time, there's been a movement into cash transfers that I think is, to be quite honest, is really coming from that initial progressive study and the studies that followed it showing that cash transfers could actually make a real difference and not have a lot of the negative behavioral effects on work and stuff and temptation goods that I think in economics we worry about. And so, there's a lot of key questions you can ask in economics, super interesting questions about how does an in-kind transfer versus a cash transfer affect a household? So one big question is, how does it affect the bundle of goods that households buy? How does it affect ultimately the amount of food they eat, maybe effects on the nutrition of the kids and such? And for this one, I think you can study this question without the government. You can go and you can give a cash transfer to households, you can randomize a cash transfer, you can randomize food distribution and see the choices people make and measure impacts on food, food consumption, other types of consumption, measure impacts on the biometrics of the kids, so the weight and the height and such. And I think this is one where you don't need to work with the government, and maybe you don't need the hassle of the government to answer this question. But there's a lot of other questions that I think are very interesting within this space that I cared a lot about. So first of all, for me, working with the government, I think there were 2 types of questions that I thought were very important. One, what were the targeting and governance implications of these different types of systems? So for many of us who have worked on transfer programs in low-income countries, one thing that we know is that there's a lot of leakage, and the programs don't necessarily get to the right people. And so it's an interesting question whether or not you have an in-kind transfer or cash. Does that change that? And there's a lot of questions there. For example, like people talk about, well, if it's an in-kind product, that's not very good. Maybe poor people want it, so the targeting is better than if you give cash. Everyone wants cash. On the other hand, especially if you can move it into more advanced banking methodologies, maybe the cash, there'll be less leakage. And when you're doing food, because food falls off the trucks and gets stolen in many cases. And so, it's an interesting economics question about how does the targeting of these programs change based on what you give out as the transfer. And that's something that you'd have to work with the government to see how it's working through the government systems. The second one is, what is the general equilibrium effect on the private sector market for these goods? And so, for example, I'm going to be talking about rice. In Indonesia, everybody eats a lot of rice. It's the main part of the diet, and so if you're giving people rice versus giving them cash, a big question is how does it change the price of rice in the market, and does that affect, especially for both people on the program, does it affect the effective transfer they get if the relative prices change, but also for people not on the program, are you changing prices on the market? So, okay, so I got this great opportunity to work on a very large-scale policy reform in Indonesia, studying these exact questions. So many years ago, so when the government transferred from dictatorship to democracy after the Asian financial crisis, they created this program called Raskin, which is like rice for the poor. And it basically, it has had slight changes over time. It used to be free rice, then it used to be subsidized rice. At the time that we started studying this program for this paper, the government was providing free rice to households that were targeted based on the proxy means test system of the country. So there was a data-driven approach to find everybody who was eligible, so it's about 30% of the country for this program based on their assets and characteristics and such, and they were targeted to be able to go and pick up 10 kgs per month of free government-provided rice. This was, other than right before this, they started introducing subsidized health insurance, but before that, this was the largest anti-poverty program in the country. And it was, it's very entrenched in the system, and it was also very popular. On the other hand, there were a lot of problems. So I'd studied this program in other papers, like different aspects of this Raskin program. There's a lot of leakage. Just rice goes missing and nobody knows where it goes. we tried to trace it and nobody can figure out where it goes. But then there's also this other issue that for a lot of people, the rice doesn't necessarily go to households that are on the targeted list. And maybe you could say maybe that's a good thing, that's fine because it's going to households that are actually poor, but my previous research had shown that that was not the case. And so you were giving the subsidies to much richer households than poorer households. There's also issues, the quality of the rice was really bad. It was sitting in government warehouses. Like if you saw it, I have pictures, it gets like not so nice. So there were a lot of problems with the program. It's also not clear you want to just be subsidizing rice because in terms of nutrition and such, you don't want to subsidize white rice. Okay, so in 2017, the government finally decided to do a reform of this program. It's called BPNT, which in Indonesian means non-cash assistance program, because it was trying to make it clear it wasn't a cash program. And it was basically a food stamps program. And so you get a debit card. So you can see here, there is some rice. There is the debit card that you would get issued by each district. There was a different state-owned bank that, based on the district you were in, that was in charge of making sure debit cards got to the right people. Then they did a big push to make sure that local markets and like convenience stores like bodegas had these machines to be able to read the cards. And you can use it for rice and eggs at anyone who had this EDC machine. And the reform was pretty big. It was switching over the entire country. They budgeted this to happen over a number of years because you can't do this switch at once. You have to get debit cards to people. You have to make sure there's enough EDC machines. So we were involved in, in the phase that was 2018 to 2019. There were 105 districts, so that's about Indonesia, that's about a fifth of the country, because Indonesia has like 500 districts, or a little less. They randomly phased in those districts in 2018 to 2019 over time, so because of that, we were able to measure the impacts of the program. And these are the districts, to give you a sense, Indonesia is very large. Here's the blue is the treatment, the orange is the control. They're scattered across the country. Less so in the eastern part that was not fully developed yet, that they were working on getting the banking systems developed there, but mostly representative of where most people live in the country. And was really able to, allowed us to measure impacts at scale. Okay, so we And I should note that we use then the national sample surveys. Because this was so large, we could use the national sample survey to look at the impacts of the program. So what did we find? So I'm just going to quickly go through results, because I know I have a tendency to drag on if I don't try to be fast. First of all, one of the things was that the targeting didn't matter. So we looked at whether or not people were spending, like changing their food consumption. Were they eating more rice, less rice? Were they eating? We saw a little bit more eating a little bit more eggs with the debit cards, but we didn't see people buying temptation goods or any of these things that we worry about. And in fact, actually, these differences we're seeing in what people ate were not large. But what was really large was the impacts of the targeting. So what we found that more of the subsidy was going to. Oops. Oh, sorry. Okay, so you can see on the first graph that the bottom is your score, basically your income score. And what you can see is more is going to households at the bottom of the distribution, less is going to households at the top of the distribution. So what was going on, what was happening was that before, what was happening was that as I said, richer people were getting access to the program. They would go to the village elder who's, distributing the program and get some. And so by the time somebody arrived who was on the targeted list, they wouldn't get the full amount of rice because there wasn't enough rice left. So they would only get a small fraction of the rice that was there. But what we're finding is with the debit card, you get the debit card, it's delivered to your debit card every month. And you go to the store and you spend it. And so people were getting they were going from about a third of their transfer to a much larger share of their transfer. And so what we found is actually interesting. It had a large effect on poverty for those below the poverty line. It was actually reducing poverty because you were now getting your full transfer amount, and it was shifting people, particularly who were kind of on the border, up above the poverty line, but moving everybody up the distribution. So the question that we asked was actually a really important one, and I don't think we would have been able to study how this worked without working in partnership with the government. Now, we learned some other things as well. First of all, the administrative costs for this program, kind of fascinating. If even the rice distribution program, we went in and we estimated all the costs of running these programs, was not large. It was about 4% of the benefits distributed. But it was much less to use the debit cards. It was even administratively cheaper. So for just changing what you were giving out, you were having these large impacts on poverty, but also saving some money for the government. And then finally, because, as I said, we were randomizing districts across the government, we could really look at general equilibrium effects. And so the national sample surveys has questions on the prices of key goods that people buy. So for example, here is the impact on the price of rice. So this graph on the bottom, it's the time to the district capital. So it's so the further away you are, the more remote you are. The closer you are, there's more functioning markets. And what you see is that the line is a little upward sloping. So in areas that are very developed with really functioning markets, this was not really affecting them. In really remote areas where the markets function a little less well, you see a bit of an increase in price. And then we went and we calculated so it reduces the effective transfer people are getting a little, but they're way much better off, even with the price increase. Because they're getting the full amount of the transfer. So it's still a net benefit, even though there is this price increase. But it's important to know because, as I said, the government, this is very representative of where most people live, but we hadn't tested the really remote areas, and this might be an issue in those really remote areas. And we talked about what it meant for those remote areas and what they should be doing to improve things as they scaled up the program. So at the end of the day, there's a lot of interesting questions to ask about cash versus in kind. What I thought was really interesting about working with the government, it changes the questions we were able to ask in a way that it has real implications in terms of people's lives. Okay, so how am I doing on time? Oh, sorry, I have no idea how am I doing on time? Oh, perfect. Okay, and we end at, okay, perfect. Okay, so The next example I want to give is a series of 2 projects I worked on, one with an NGO and one with a government. And they had similar results that were somewhat similar, but somewhat different for different reasons, and I'm going to explain why. And this really gets at, when I talked about at the beginning, some of these implementation issues and how they affect what you can and can't do. You see them quite in practice over here, and also some of the broader issues about interactions with markets. Okay, so many years ago, actually I started this 25 years ago maybe, or not. I was looking at how to get teachers to show up to school. So in a lot of places, you have a lot of bureaucratic absence, so the teacher doesn't show up to school, the health worker doesn't show up, and it really affects the quality of services if the person providing services are not there. So, for example, in this area of India that I worked in, there was a study done in 1995, and it showed that teachers were only present about 60% of the time. In the baseline for the experiment I worked on, we saw it was about 65% of the time the teachers were there. So we looked at a study where we provide monitoring of teachers and financial incentives for the teachers to come to school in these NGO-run schools. And so the idea was, the reason why I said this is a very old project is that we're using not digital cameras, but cameras with actual film. Cameras, as you can see in the picture, and the idea was that the teacher and the kids would take a photo at the beginning and the end of the school day, and then the teacher would be paid based on the number of photos. And then there were some, it was meant to not penalize the teachers, it was meant that they could earn more if they had very good attendance, and was trying to motivate them as well and show them that the job's important. So we're working in 100 and some NGO schools in a part of Rajasthan. And the original study had, okay. Okay. It had really big effects on attendance. So as you can see in the graph in this study, it went from 58 to 79%. And the NGO ended up scaling it up to the control group as well. And I was curious, I went back to check, and the attendance rate at that point was still 83%. So the cameras increased attendance. Now these were not government schools. These were one-room schools for kids who are really at risk. They're not going to government schools. The teacher often maybe had a high school degree. The NGO would train them, but they're not, official teachers. So there's a question about whether or not the kids would learn. And it turns out that if you just get the kids in the room with the teacher, test scores increased, and the fraction of kids who graduated out of the NGO school and were mainlined back into the government schools instead of just dropping out altogether was quite high. So it was a great program. Okay, so then many years later, the government of Karnataka, so a large state in India, which I see Paula laughing at because she worked on this project many years ago when she was my student, decided to do a similar pilot in their health sector. So it's the same problem in the public health sector. Attendance was low, so we saw when we did random checks on the health centers, the doctors were there 40% of the time that they should be, and the nurses, the pharmacists, lab techs were there a bit more, so they were about 49% of the time. And so there was the head of the National Rural Health Mission was very innovative, and so he decided to do this fingerprints. So you would show up to the health center, put in your fingerprint, you'd leave for the day, you put in your fingerprint, you can see the machine, it's connected, it would mail the fingerprints to email the fingerprints to the capital city, and you'd be able to monitor people's attendance really well, and then you'd be able to enforce the government rules on the workers based on their actual attendance. And so, and this was really important because not only were the doctors and nurses not being there, they were not taking vacation days, and so they would cash out their vacation days at the end of the year, so there was this additional fiscal cost to the government that they were paying all this extra vacation time, and then they had workers not really being there. So the idea that the government had was that they were going to connect it to the actual leave policies, so you would take your vacation day if you were absent and really try to get the system to what it should be like based on the theory. Okay, so this is a project, I didn't come up with this. I just want to be clear. It's not that I came in as a researcher and said, here's an idea, why don't you do this? This was a project that the government conceived before I came in. They had developed the machines and procured them before I came in. And where I came in is that they had contacted us to say they want to evaluate it, how should they evaluate it? And they had planned to pilot it in a number of health centers, and the main thing I did was get them to randomize it and then set up the data collection around it. So as I said, the reason why I say there was high government buy-in, so it doesn't seem like I forced this on them, and that's why you get the results you got. Okay, so the first thing they did is they trained everybody on the systems, and we went around, and after we were trying to stay out of it, have the government program run on its own. After they did the training, I think we went to about 11 centers. I showed up to some of them, my team showed up to others, and they were all in boxes. So we ended up playing a little bit of a role in the program in that we went and we presented this to the government and said, you have to redo the training and do it properly. Do it in a way that makes sure that people are using the equipment and actually show that you're serious. So they did, and in fact, actually, so these are my random checks on the health centers afterwards. Everybody received the system, and about 2/3 of them were functioning when I got there, which, not bad. Okay, but then it was interesting. We found very different results in the NGO setting. We found no effect on doctors, none. And we found an effect on nurses, lab techs, and pharmacists that they were there more, than the doctors. Now, why is this? This is very different than the NGO setting, where the NGO could just, change everybody's. So here's the new incentive scheme. That's what we're going to pay you. In the government, it's actually quite hard to do because of the bureaucracy. So to cut the leave day officially, you had to give them send a letter, a show cause notice, and then allow it appeal. So there's some time goes by, then you allow it at appeal, and then it works one's way through the sub-district health officer signs off, and the director of health and family welfare signs off, and the director of accounting general needs to sign off. So there's a whole bureaucratic system, so it's not actually that easy to cut somebody's leave based on data, to say that somebody was absent based on data, if they haven't officially put in for the time. And so that made it really hard to actually enforce the rules in practice. But there was also this other thing. So what was going on? So if you ask the government officials, why aren't you trying to enforce the rules more? It wasn't even that it was just hard to enforce the rules. They weren't really going through the process. They were saying it was two reasons. It was because of human resource constraints, because of organizational constraints. They have a lot of vacancies. And if you make it a less appealing job, you're going to have more vacancies. And that would counterbalance the impact of the attendance. And so this was actually, I think, quite true. So first of all, we measure the happiness level in the staff in the treatment and the control, and the staff in the treatment were a lot less happy than those in the control group after the program. There was another thing that was interesting. There was many more vacancies for doctors prior to the experiment than the nurses, pharmacists, and lab techs. And we looked at the effect of the treatment in the areas where we had the treatment was running, and it was actually enforced by the doctor and his staff, his or her staff, the nurses and the lab techs. We actually found more vacancies, so it did increase vacancies for those that it was enforced on. Now, why is this the case? We did a lot of qualitative surveys and understand why. And what was kind of interesting is that because of the markets for doctors and nurses are very, very different. For doctors, you have the outside option of working in the private health sector, which has higher wages, but less good work-life balance, as they said. Whereas nurses and the lab techs typically live in more rural areas and want to work to where they live. So they're happy. They have limited job options available as compared to the doctor, which is in the city and doesn't necessarily want to go to the rural area. And so what was interesting to see the differential results with the study with the government versus the nonprofit is that, one, the challenge as an organization that you're facing is very different than in the nonprofit, which is smaller scale and a more constrained location and a different segment of the labor market than when you're working with public sector employees that face a very different labor market. And even within the public sector employees, there's differences there as well. And so you learned a lot about how these things function in practice, these incentive programs, in the government setting that I think is very different than in the nonprofit. Okay. Okay, and then my third Okay. I feel like I'm talking a lot, but I guess. Okay, so my third project I want to talk about is this one on community-based targeting. And as I said, this is very near and dear in my heart. I feel like I spent most of my career working on this, as you'll see. And it's a topic that I think many low and middle income countries face, is how do you identify people who need help in transfer programs, or if you want to target scholarship programs or other types of programs, because there's so much informality. There's just no information out there about people's incomes that's easy to use, and so I've worked on this for a very long time, as you'll see. Given this, I think what has happened in a lot of countries is that they use this thing called proxy means testing. So in very high income countries like the US, we use means testing. We get your income from reported service, from the firm you work on, you've got tax information, you've got all these sources of information about income, and we use this to test, do you have the means or not to cover things on your own, or do you need help? But so in a lot of low-income countries, you use proxy means testing, where you go around and you do an asset survey, where you collect data on lots of assets, demographics, and you use some statistical models, and you do a prediction of who should be, who's below whatever poverty line you're using. And there's lots of challenges in doing this. There's a lot of error. I mean, it has signal. It has a lot of signal for a lot of countries, but also has a lot of error. There are errors in the model. We all know, we've all run regressions. Models are not, we're not going to get things perfectly predicted. It's often based on the permanent component of income. So if you have a nice house, but the income earner in the family just died, you're going to miss that. And that family is going to be on a very different track than somebody who's the income earner hasn't passed away. We miss households all the time. Oftentimes they do this as a census, trying to reach as many households as possible, but in practice, a lot of low-income households that live on more remote areas often get missed. And it also misses what the local conception of poverty. If there are differences in what poverty look like in different areas, that can also lead to a lot of political issues. If you're imposing one notion of what poverty looks like in this area, but people have a different view and they view the program as unfair. So there's been another alternative, which is to bring communities into the decision-making process with the idea that, an enumerator might come and my neighbor hides his motorcycle under a tarp, and so he looks like he's poor, but if they ask me, I know he has a motorcycle, and so the community might have more information about people in their community and who actually needs help than this enumerator coming in to measure data. Now, this also has a lot of challenges, and it's not clear it'd be better than the data-driven approach. First of all, it might be that communities don't have information, and particularly this is a concern in urban areas as well, where you don't have the traditional, village structures, and people are moving in and out of communities. Maybe the information is in the community, but it's hard to aggregate it up to get that information to be used at a higher level. When we started this process, and I must say, this is where RCTs, experimental work, can really change your mind, because I thought this was going to be true, and it wasn't, was that the rich and politically connected were going to totally capture the process. And other things. We're human beings. You might choose your friends rather than the poorest person. Things might happen in terms of how these things work. And so I must say, I was actually very skeptical when I started working on this, how does the community information versus the proxy means test work? I updated a lot, as you'll see from some of the results. Okay, so many years ago, we worked with the government to compare. They were trying to update their targeting database, which is some combination of a proxy means test and some community-based information. And they wanted to know, should they move more into the proxy means test fully, or should they bring in more community information? How do you update these kind of data sets? I thought it was such an interesting question. But the government was also worried about connecting it to a real program, because if this went completely wrong, it would be a political fiasco. So what we did is we worked with the government, and the government was working with us to do the targeting, but we created a program just for the study, which was basically about, so there's real stakes, but it was basically about 1 day's worth of work for somebody below the poverty line. So it's a fair amount of money, but less, much less, as you'll see, than what you could get in a broader transfer program. And what we did is we compared the proxy means test that the government does. So they have lots of asset indicators, like what the roof is made out of, what the floor is made out of, how many rooms are in your house, the education level of the head of the household. So this was sort of business as usual, the proxy means test. And then we compared it against a community method. And here, okay, so here are some pictures. So the way the community method worked is that you brought together the community into a meeting, and usually about a third of the community showed up, roughly. And then you say what this is for, the program is for, the same way you would say what the program was for when you're doing the PMT. And you say, conceptualize one, and everybody think about what poverty means. And then you have a stack of index cards with everybody's name on it in the village, and you start with the first two. Which one's poor? And you rank those. And then you take the next one, and you say, okay, where does this one go? And you ranked it on a string. And it seems a little bit ridiculous, but working with the government and a nonprofit that did community facilitation, we tried out many different methods, and this was the one that actually worked best. In terms of thinking about how do you get this information, aggregate up this information in a way that didn't overload people. Okay, so what did we find in the pilot? So the community targeting was progressive. The communities were giving to people who are poor. It was kind of fascinating, though. It performs, if you look at just household per capita consumption, it performed slightly worse. It wasn't as good as matching household consumption, but we also had individually interviewed people in the community. It was much better at matching individual community members. So it was aggregating the information of the community up really well, and it was generating much higher satisfaction. Even though the difference between them wasn't that large, people felt like they had voice, and they were contributing to it. And when they were making differences with the consumption, it was kind of fascinating. Like for two people with the same consumption levels, the community was more likely to give it to a widow or somebody with a much lower education level that they were using. They weren't, even though it was different than just pure consumption, it was a little bit worse. They were using other indicators that predicted vulnerability in different ways that I think were very important. So it's a trade-off, which one is better, to be honest, I think. We found very little evidence for lead capture. I'm not going to explain it all because I don't have time. We did a whole bunch of things to look at lead capture. We did a whole bunch of things to look at information aggregation. And anyway, so we found little lead capture. Okay. So then I want to compare this to two scale-ups. So we did the small scale pilot. What happened in the scale-ups when it went at large, and what do you learn? Okay, so the first one is was kind of fascinating. So when we presented these results to the government, they're like, yeah. But what happens if you connect it to a real government program? I'm like, you didn't let me do that. And so they asked if we could do it. So so Indonesia has a program similar to Bolsa Familia, similar to Progressa, which is a conditional cash transfer program. There was an RCT of it and a pilot phase, and they were scaling it up slowly across the country. In terms of the scale up, we did randomize whether or not you got a PMT or community targeting to enter the program. So, and here, as I'll show you, there's a lot of money at stakes. It's not just like 1 day's worth of income. The other one, the other scale up was that during COVID-19, the government was very concerned, like many governments, about vulnerable households. People had been missed, people whose economic status had deteriorated since the last scale targeting. So they created a new program, which in the villages got block grants from the government that go to public goods. They were told that they could allocate that through community targeting as private transfers to households. To identify people who needed help or were not already receiving government assistance. And so this was launched in April. When friends in the government sent me the PowerPoints of this with like the citations to the paper, I was very proud. they launched it really quickly. By November 2020, 8 million households had received these community transfers. So we were saying, well, what happened with the scale up versus the national government program? And I know I'm running out of time, so I'll go very quick. You can see a huge difference between these. Then the pilot, we were targeting 4,000 households, and the national scale up targeting 8 million. In the experimental scale up, you could see it was about $970 compared to $3. So the amount of money, and the national scale up was somewhat in the middle because it was a couple months to keep people going during the crisis. So you can see there's a lot of differences in terms of the way that these programs operated. Okay, so the first fact is, as I said, during the pilot, community targeting was progressive. So that's the first graph. It's basically the log of your consumption, baseline consumption, graphing your probability of getting the program. You can see it's downward sloping. It's actually the poor are receiving a larger share than the rich. In the experimental scale up, you see that's the case too. Although you can see the levels are different because the first program was targeting the bottom 30%. The second program was targeting the bottom 10%. There's a lot more error there. And then here's the national scale up as well. And I'm showing you two graphs. The first graph is deleting everybody already on the social assistance program because they weren't eligible, and you see it downward sloping. And the second graph is combining it. So getting the program is being on social assistance or the community targeting added on. And you see both led to a progressive system. Comparing the two, so we can compare the experiments. So we got the pilot and the experimental scale up. And as these are the results I told you, that the community did slightly worse. Slightly higher consumption people got the program. Again, it depends on the specification you use. It's not significant here, but it is another. But when you use the individual community rankings, it better matches. And that happened both in the pilot and the experimental scale up with the real money attached. It wasn't that when real money was attached, it did something totally different. For the national program, we don't have a PMT. We don't have a comparison group because there's a national program, but we can simulate it, the proxy means test, who would have gotten it in the baseline data. And we do that for all the studies just because we know our simulations do better than how it actually works in practice. And what you see is the program, it looked pretty similar out, that it did better on consumption. In the paper, we show that the same thing happens. When they differ from consumption, they're more likely to choose widows, actually in the COVID-19, it was fascinating, they're more likely to choose people at baseline whose income mostly comes from remittances, because that was the big challenge during COVID. So they're making sensible decisions. But in the end, actually, the reason why I mentioned this study is that, this scale up came from the government actually having real evidence that the community targeting could work. And that's why they were able to launch it so quickly, because they needed to do something fast, and they could do this very fast. And a lot of trust in the studies, because we had done every single study with them. Even the first one where we created the program, they were still running the targeting. It was completely joint in terms of the questions, in terms of the outcomes. And I think for me, this other benefit of working together is not just the realness of the results, but also the relationships that develop in terms of trying to think about how do you influence policy. And I think, especially, and I've been thinking a lot about this, especially in this day and age where a lot of evidence is being distrusted, and maybe we're not always, as a community, economics community, as good as explaining what we do and how we do it and what the results are as we could be. This idea of a joint partnership and seeing it with all the nuts and bolts is a way of really generating a trust in terms of how the research is generated and what it means. That could be quite important. Okay. To conclude, I think I probably ran over time. I didn't mean to. I think for me, as I said, I've been thinking a lot about this. Working with governments has been super interesting because it's not just a policy evaluation, but oftentimes it could lead you to really interesting questions that you can't necessarily ask if you're doing it without the government. It's important because how things work in practice at scale, given real-world conditions, is often very different than in small scale. So that's also important. The general equilibrium effects and how things react to the market. And as I said, this thing about working together to build trust I do think is important. But it's also, for me, been, and this is how I'm concluding, very challenging. I've had situations where people haven't been happy with the results that we found, where there's issues around legitimacy of governments, issues around rights. I've turned down projects on targeting where I thought targeting could be used in a way that might limit minorities being involved in the program, for example. So there's a lot of, as we think about when do we work with government, there's, a lot of philosophical questions that we think about, and then how is data used and consent around data, and how is it safeguarded? I know I've also worked a lot with administrative data, and a lot of these issues come up as well. And I think these are important things that we need to talk about more as we're thinking through our economics research, and goes back into these issues around the trust in the studies and the trust in what we're doing. And so I'll conclude there. Sorry, I think I ran over time, but thank you. Yeah.
Thanks for a great presentation. So one small question about the community ranking, which kind of immediately made me think about stigma, because you're ranking people publicly, and whether you see any evidence of that, and kind of linking to this last point, if you could comment on what was the kind of critical elements to keep this sustained relationship for a longer period of time with governments, because obviously there is political turnover and at higher levels, and how do you keep these relationships going, perhaps at lower levels of administration? But thank you.
That's great. I was getting a pen. Oh wait, I lost my bag. Oh, to write down. Anyways, I think those are both good questions. On the first question, I was actually really worried about that. So I must say, this is where the RCT and doing this kind of fieldwork completely changed my mind. I thought people would be, if it were me, I'd be very unhappy to be in this meeting where people were talking about me. I'm not a public person. And then I also, and I also felt like it might get mired in corruption and people wouldn't be active in these meetings. And so seeing it in practice changed my mind. So I was very attuned to this stigma issue at the beginning, and then we were piloting with a nonprofit, and we didn't see evidence of that. I think culturally, in a lot of lower income countries, people don't want to be seen as rich. So it actually worked in the other direction. People didn't want to be labeled as rich. Everyone wanted to be of the people and poor. So we didn't have the issues there. It's a good question if it would work differently in a culture where there would be stigmatized towards the rich, and I don't know. But it's a good question. I was actually having this conversation with a friend at one point. I was like, I don't know if this would work in the US where you see a lot of stigma. And she was raising the fact that in her church, they basically do this. They have these meetings where they discuss who needs help. And so I don't know. It's an interesting question if it would work in a setting where maybe there's more stigma around poverty. We also tested, because of the stigma and elite capture issues and stuff, we also tested if you invite everybody versus just have a small committee, which I didn't get to talk about as much, because we thought that might overcome the stigma issue, because you get the information but don't. And we also, the results look pretty similar, so I don't think this stigma was an issue. The second question, this is a good question. I'd love to hear other people's views as well. I think it's challenging. I think for every project I've worked in, I've known who in the government has made it happen, and without, I'm interchangeable. You can have another researcher there and the project could still happen. But I do think without the person in the government who, it's a role of leadership to be able to say, I'm going to open myself up to information that might make me not look always that great, but because I want to learn from it. And so you really need people who do that. And I think it also depends a lot in different countries in terms of the politics and in terms of the structure. For example, done a lot of work in India where, every 9 to 12 months, the IS officers, the government of technocrats, gets shifted to another position, and it really affects both long-term planning of policies, but then also the research. And so that's been extremely challenging, and I've had projects that have been canceled because of that. In Indonesia, there has been people in the government in more technocratic positions who have been there for much longer because they don't switch as often, which has led to more stability there. So it also depends on the structure of the bureaucracy as well in terms of maintaining these relationships. maintaining these relationships. Yeah, I have many horror stories of projects being canceled. So like, because of these shifts in the political winds. So I think this is it's a cost of doing these kind of projects. Yeah. Yeah.
Hello, Rema. I had the experience of working in a municipal government in Recife, Northeast. And as a person trying to do evaluations of public policies, I realized that politicians don't really like randomizations. They always have their own way of thinking about targeting and what is the optimal way. So how could you convince all these politicians to do randomizations?
Yeah, this is a good question, because I think it is true. Just people will have their own views about how they want to distribute policies and programs, and that happens everywhere. I think, we were working, in different, as I said, in every project I've worked on, there was somebody there in the government who cared enough about the evaluation results that not only did they want it, but they also did a lot of politicking within the government to be able to make it happen. Sometimes I'll tell you a funny, so sometimes it's like you spend months and months just working on this one issue, and maybe it works out, maybe it doesn't, and it's a process of, also, to be honest, there's a lot of things you don't see on the actual paper, like a lot of data analysis we do for the government, things that to be useful, and to show why this could be useful and to build up to this. So it's not just coming in and saying, let's randomize, but it's really a relationship building. In one case, actually this project, it was very funny. This project with this randomization, I have a very funny story about how this one came about. So I'd worked for many years with this woman within the Ministry of Planning who is awesome, who really just cared about evidence and research and was very savvy as well. And so when they were deciding, they had a set of districts, and when they were deciding the ordering of the districts, everybody was politicking, over which districts they wanted. And it's like an intergovernment thing. Like, this project was very complex. It seems like super simple from what I described, but there's the Ministry of Social Affairs, there's the Ministry of Planning, there was the President's Office, there's all these different, there's the agency that runs Raskin, there's the banks, so all these agencies, everyone on these interministerial committees involved. So one day she's like, can you guys call me? So my co-author Ben and I called her, because we were planning to do some research on this program, but we didn't think they would let us randomize the districts. And she was like, can you guys, I was thinking, if we randomize the districts, could we evaluate the program? And we were like, yes. And she's like, well, why don't you randomize it and give me a list? And we was like, okay. So we randomized the districts, and actually we had to do it several times because the districts in the study kept changing. Like, they kept adding, like, the president pulled out some districts that he definitely wanted them. Maybe that shouldn't be in any recording. What he definitely wanted the program going to. Anyway, we ended up with the sample. And she had this list, and everybody was politicking on their list, and she kind of won. So it was kind of a very ad hoc how it got done. It wasn't that she's like, we're going to randomize for evaluation. She was like, this is my list. It's fair because I've randomized it, and we're going to do this. And she kind of won. So sometimes it's also a little bit of luck. Yeah.
Thank you.
Yeah. I wish I had something more profound than that, but sometimes it is a little bit of luck. So, yeah. Oh, yeah.
Thanks for the fascinating presentation. I was thinking about the third project. The way you presented is if it was a one-off, decision between, the objective choices and the community-based. But if you think about like a, government project that might stay in place for a longer period, when you think about the objective criteria, this is like, basically the same criteria being done, every time. When it's community-based, I was thinking that this is could be more like a dynamic game that they are playing.
Yeah.
So, these guys got selected now. What did they do with, the benefits? Did they deserve to be there?
Yeah.
So I was thinking, whether you encountered this issue and, how do you deal with that? Maybe this is a good thing, that there might be an implicit system of rewards and, in this other type of evaluation. So I want to see your views.
So you raised two good points. So the first one is, the answer is I don't know. So for the PKH program, it's a program you get on for 6 years. So and you stay on longer for most people until your kids grow up. And so we weren't able to see in a second round what happened, because once you're on, you're on. And a lot of even the targeting for the general targeting list happens between 5 to X number of years later. So we don't know for sure if it changes over time. It's a good question. I think from the little we've seen in some of for example, in the national scale up, they did it over several rounds, and it seems to be steady over those rounds, but it was also in a very short, compressed amount of time, so I don't know. So it's a good question. I agree with you. It's a dynamic issue. I phrased it as you do this just to be able to quickly go through the experiments. I think for them, where they view the community targeting as important is that they do the proxy means testing every X number of years. And then there's no way to really update it, because it's costly to go and to collect this data for everybody. And so we're thinking about how do you incorporate the community targeting to updating the list. So it's not a full scale changing the list, but people who have become newly vulnerable, trying to add them on. Again, I don't know how we haven't fully tested that, but I don't know how that fully changes over time, but that's where they viewed this as being important. And then during COVID, they viewed it as being important because they realized that they couldn't actually go and figure out who is newly vulnerable, so quickly. And they viewed it as this is a quick way to do a temporary program in a fast way and get money out the door to people who needed help, and we tried to evaluate it. So again, I don't know if I have a great answer for you, but yeah. Yeah, I'd love to do the dynamic version. That they haven't allowed me to do yet. I'm not sure if anyone will allow me to stay that long changing the targeting of the system. Oh. Okay. Great, thank you. Okay, thank you.